Hi, I'm Steve Adubato. I'm about to introduce you to a fascinating physician and a business person as well. He is Dr. Michael Harris, Chief of Surgery and Surgical Services at Englewood Hospital Medical Center, and also author of Excellence with an Edge, Practicing Medicine in a Competitive Environment. You said to call you Dr. Mickey Harris. Mickey, they call you Mickey?
Mickey.
All right,
my
Mickey.
mother calls me Dr. Harris.
All right, doctor. Let me ask you this. Why have you said the business of being a doctor is complicated?
Well, it starts, I guess, with the fact that that no physician ever has been taught that the practice of medicine is inherently a business.
Why not, by the way?
Well, we all go into medical school thinking we're going to, help people. That's, and we do, and we want to. Nowadays, everybody's goal is to open a clinic in sub-Saharan Africa. They're going to go to Bill Gates and they're going to say, I want to open a clinic. What they don't
and they need a grant.
Well, what they don't understand is that Bill and Melinda are going to say to them, well, listen, what's the model? How are you going to keep your lights on? How are you going to pay for the materials? And that's just never taught. We're taught how to practice medicine. We're taught how to deal with patients sometimes. And but we're never taught that actually we have to we have to make a living. It always was assumed. As time goes on now, with the practice changing, not only with the Affordable Care Act, but even well prior to that and things that are well beyond that, you as a physician need to understand the environment in which you're providing care.
Can you truly be an effective physician who spends time, quality time, with patients, asks good questions, is a good listener, tries to really diagnose in the way that a physician needs to diagnose, and still see enough patients to be efficient and effective and pay the bills and keep the operation going and make money?
It's a great question, and I would submit that the answer is you can't not do that. You won't survive if you're unable to do that, and part of surviving and thriving in this world is the ability to manage your time and your business in a way that that allows you to do just that.
And the research for the book, the biggest mistakes that most physicians make in trying to be competitive in this environment are?
Also a great question. I think...
That's all I have is questions. I don't have answers, doctor.
I'm not sure I have all the answers either, but there are a lot of different mistakes. I think people sort of focus on one area only to the exclusively rather, to the detriment of the other. I think there are many, most physicians focus on the practice and they focus on the time they spend with the patients and ignore the business. There are some, albeit fewer, who are purely business guys. And they've come in and they recognize that it's a business, but they focus too much on the business, and what gets falls out is in between. And I think that there are very few that have the balance of both that is required.
What kind of reaction have you gotten from your colleagues to the book, your research, and the things you say?
It's been very positive. I think people recognize now that these are difficult times. They recognize that as they progress in practice, they are seeing things. They're exposed to an environment that they weren't prepared for, and the fact that there are people like us who are trying to help them cope with that environment and really learn to thrive in it has been very well received.
I'm curious about this. People in medical school right now, to what degree are medical schools adapting to what it is you are saying and literally teaching future physicians how to be better businessmen, better businesswomen, so that they are not struggling as much to find this equilibrium, this balance?
It's tough sledding. I think there are a few.
And by the way, who would do that in medical school? Would they need to be business people?
Well, they
or at least
be
successful physicians
yes,
who have been able to pull this off.
Correct, or some combination of both. And there are more physician executives as time goes on. There really has been a push in the industry for physicians to become more business savvy. You'll see a lot of hospital CEOs and presidents now or MDs. Very few medical schools have a formal business program. The program that I started when I was back at Mount Sinai was only the third in the country, and it was an elective. Now, it was an elective that virtually every student who had elective time took, and now we're starting to see, this as part of the mandatory curriculum in very few schools.
In the time we have, I want to give you a chance to talk about your practice. Describe it.
I personally am a GI surgeon, gastrointestinal surgeon. I specialize in taking care of patients with Crohn's disease and ulcerative colitis, which are grouped as what's called inflammatory bowel disease. I also take care of people with colorectal cancer. That's really the scope of my practice, almost exclusively those. I do large reconstructive gastrointestinal surgery, and have been doing it for 25 years back at Mount Sinai, and was recruited a little over a year and a half ago now to go to Englewood Hospital as its chief.
Word is you often spend, initially, as much as 90 minutes with a patient in an initial consultation. I don't get it. And what does that have to do with successful business?
Well, I'm fortunate in that respect, in that the nature of the surgery that I do allows for that. The days are long, and you know, doing my other jobs in between and patients and after. But my feeling has been that time up front with patients actually saves a tremendous amount of time later. I lay out with patients basically all of the expectations, answer all of their questions, and what almost never happens is me getting a phone call saying, you know, doc, you know, can you explain this to me? I don't understand what's going on, or, you know, you didn't tell me this was going to happen, because we really spend that time up front. Yeah,
real quick, the minute we have left, you've often said in your practice it's like selling Porsches, not Yugos. What does that mean?
Well, that's again the nature of my particular practice. That doesn't necessarily lend itself to all practice, but you know, depending on the nature of the work that you do, you have to you know, you have to sort of find your niche. You have to find a way to take care of the patients in a way that that is justified by the time, the effort, and the expense.
Dr. Michael Harris, you have a lot of hats that you wear, and we appreciate you coming in, but your book is clearly going to create a buzz and make a difference. It's called Excellence with an Edge, Practicing Medicine in a, I would argue, a very competitive environment, getting more competitive all the time. Doctor, thank you for joining us.
Thank you.
Because we're friends, we'll call you Mickey from now on.
All right.
Thanks,
Thank you very much.
it.
Thanks
Stay
for having
there.
me.
One-on-one will continue right after this. Thank you very much.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the New Jersey Education Association, working for great public schools for every child, Wells Fargo, the Adler Aphasia Center, PSE&G, committed to improving New Jersey's economy and strengthening its communities. New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. The law firm of Gibbons PC. Horizon Blue Cross Blue Shield of New Jersey, making healthcare work. And by Bloomfield College, offering small classes and big opportunities since 1868. Promotional support provided by the Star Ledger and NJ.com, Everything Jersey, and by NJ Biz, All Business, All New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.